Hello YouTube, I'm Dr. Fox. Today, I'm talking about postpartum checkups. Today's key points are a postpartum checkup can be defined as a medical examination you receive once giving birth to establish that your health and recovery are sound. Postpartum care is vital as new mothers are more likely to develop particular health complications, which can occasionally be life-threatening. Speak to your healthcare professional for guidance on a postpartum care plan and how to make the most of your team. Book yourself in for a postpartum checkup within 6 weeks of having your baby. Certain complications experienced during pregnancy can lead to further complications after giving birth if not monitored, including for individuals with any chronic health conditions. Okay, let's talk about understanding postpartum checkups and their importance. Postpartum checkups are in place to examine your health once you have given birth so that the challenges of labor do not lead to complications. Mothers should attend these checkups even if they feel in perfect health because underlying conditions might not always show immediately, meaning that your pregnancy care is not yet complete. Complications can occur even weeks after pregnancy, which can range in severity but even be life-threatening. So new mothers should always look to be vigilant regarding their health. Failing to attend checkups has led to unnecessarily illness and even death that could have been prevented. All mothers should prioritize postpartum examinations, which are also crucial for those who have experienced one of the following tragedies. 1. Miscarriage, when a death occurs in the womb prior to 22 weeks of pregnancy. Stillbirth, when a death occurs in the womb after the first 22 weeks of pregnancy. Last, neonatal death, when a death occurs to a newborn before they are 28 days old. Women who have experienced these loss may not feel like attending appointments, but such examinations are vital for your medical team or genetic advisor to understand any complications that occurred and whether they are likely to do so again in the future. The role of genetic advisor is to inform you regarding any gene-related complications, conditions that may be hereditary, and possible birth defects, together with the likely impact they might have on your health and your babies. Okay, next. Once you have given birth, when should you see your medical team? Professional caregivers should meet with mothers and their newborns before the baby is discharged, like 1 week old. By attending this assessment, a baby's health can be examined and mothers informed regarding any maternal complications such as feeding requirements. Doctors and midwives will also request healthcare assessments, usually during 4 to 6 weeks after delivery. If you regularly see an obstetrician, they can provide such care, but it is also crucial that midwives and pediatricians are involved. Okay, let's talk about what to expect from postpartum checkups. The focus of postpartum examinations is to analyze you and your baby's health and reach an understanding of how smoothly these first weeks of life are progressing. The examination will likely include weighing and measuring the baby, establishing whether breastfeeding is successful, assessing the baby's intake and diaper performance, advice regarding any nipple or breast pain, inquiring about the baby's latch, information regarding any bladder or bowel complications, if a C-section was performed, checking your incision, inquiring how well your perineum is healing, inquiring about your bleeding, asking after your mental health, so any mood swings, screening for any signs of postpartum depression, checking if any birth control measures are required, any glucose test or blood work required, carrying out a pap test if judged necessary. Okay, so what occurs during a postpartum examination? During your postpartum examination, Your medical advisor will look to ascertain how well you are recovering from the challenge of giving birth and also your well-being in relation to becoming a parent. Examples include the following. Key checks likely to take place include to your belly and breasts, your weight, and also your blood pressure. If a C-section was carried out, health professionals usually request to meet with you to make sure that everything is healthy with your incision. A C-section requires making a cut through your belly and uterus, and while the majority heal without complications, making sure that infections do not occur remains essential. Okay, next, a pelvic examination involving a check of your birth canal or vagina and or uterus and cervix. Sitting at the top of the vagina, the cervix is the opening to the uterus. In cases where a tear occurred during birth, if you required an episiotomy or a cut made at the vagina's opening, the professional will need to check this is healing successfully. Your professional will also inform you when it has become safe to have sexual intercourse again. Okay, next, any health complications that occurred during pregnancy need to be checked at this stage, examples of which can include high blood pressure and diabetes. A form of diabetes, known as gestational diabetes, is a condition that some mothers develop while pregnant, so your healthcare professional will need to carry out a blood glucose check to check that sugar levels have returned to normal. For women who are breastfeeding, they will need to ask for professional advice regarding any medicines they wish to take, as some medicines may be unsafe and so you will need to use an alternative while your baby is still suckling. Also, consult your advisor before deciding to stop using any medicine. Okay, last. Another issue is making sure that any required vaccinations are up to date, such as for flu and hepatitis or whooping cough and rubella. Vaccinations can be crucial during this time to prevent you from passing on any illnesses your baby might not be immune to. Okay, next one is birth control. Postpartum appointments will be the time to discuss birth control even if the subject has not come up previously. Your healthcare professional can advise on a range of options, which you can then choose from depending on your plans to have more or to avoid having more babies. Inquire regarding the use of an IUD or implant, as these can prevent mothers getting pregnant too soon than is good for their health. Complications experienced during pregnancy, labor or birth can have a knock-on effect for some mothers. Therefore, postpartum appointments are the ideal time for safeguarding future health and also your ability to have more children even if that is not a pressing concern. For example, premature births are known to increase the risk of another premature birth occurring in the future, so health professionals can be informed and act to help you avoid such a scenario. Even mothers who don't want to have further pregnancies should take these precautions just in case and also for their general health. Mothers who have given birth prematurely or have experienced gestational diabetes or gestational hypertension or high blood pressure are at greater risk of preeclampsia, for example, which also increases the likelihood of cardiovascular disease in later life. Impacting on the heart and blood vessels, cardiovascular disease or heart disease is one of the leading causes of pregnancy-related death, which can include serious events like heart attacks or stroke. Lastly, anxieties of becoming a mother. Keep your professional informed regarding how you are adjusting to the challenge of parenthood. New mothers are likely to feel a combination of exhaustion and stress, as well as questions about general care for their baby and breastfeeding complications. Be open about any lasting negative emotions such as gloom or apprehension. If you develop postpartum depression, this will make the challenges of looking after your birth difficult together with your own well-being. This form of depression will need medical treatment for it to go away. Okay, next is the dynamics of a postpartum care team. Your scope of postpartum care requirements may extend to a range of related services applicable to treating a range of health conditions. Therefore, your postpartum care team might consist of a wide range of experts to assist with the challenges experienced after giving birth. Chronic health conditions, which are considered chronic for being persistent and requiring ongoing managing, can be high blood pressure, which is assessed by the force of blood that presses against your artery walls. Arteries are blood vessels that transport blood from your heart around the body. When such artery pressure is too high, a patient has developed high blood pressure or hypertension. This is a health condition that places extra strain on the heart and kidneys, possibly resulting in heart and kidney disease or stroke. 2. Obesity. Individuals with obesity are considered to have excess body fat with a BMI or body mass index being 30 or more prior to pregnancy. Height and weight are utilized to establish your BMI, which can be obtained at some websites easily. 3. Pre-existing diabetes or type 1 or type 2 diabetes, a medical complication that results in your blood having too much sugar or glucose. Diabetes can develop at all ages, though is more common in older people and can affect the functioning of many organs, especially blood vessels, nerves, eyes, and kidneys. 4. Thyroid conditions. A gland in your neck that produces hormones. The thyroid helps your body to store and make the most of the energy you consume. If the supply of these hormones become affected, then health complications can occur. 5. Kidney disease. Kidneys play a crucial role in filtering waste and excess water from your body. This keeps blood pressure and hormones at healthy levels, as well as various other body chemicals. Patients who develop chronic kidney disease or CKD become unable to filter blood adequately, leading to a build-up of waste. If left untreated, kidney failure can be the consequence. And last, mood disorders. Our emotional health can be affected by various mood disorders, leading to depression, often referred to as clinical or major depression. Patients with depression experience excessive sorrow and a lack of enthusiasm for their typical daily interest. Emotions become unpredictable, impacting on how individuals perceive their lives and behave. Medical treatment is required for depression to be controlled. So healthcare providers who play a vital role of managing any pregnancy complications or the development of chronic conditions. A range of expertise might be incorporated for the various tasks, such as a maternal fetal medicine specialist or MFM, who are doctors whose career development has been directed toward safeguarding mothers categorized as high risk during pregnancy. Other experts will assist pregnant women who encounter challenges with emotional and mental health, including depression, meaning mothers may also have to work with various therapists, counselors, psychologists, social workers, psychiatrists, and psychiatric nurse practitioners. Your baby's healthcare provider who has specialized healthcare training to address any of the complications that babies and young children can develop. Exams can include a pediatrician who has skills that are relevant to caring for babies and children, a family physician whose scope is the welfare of all family members, including the baby, though their work may begin prior to giving birth, a neonatologist who specializes in newborns with complicated health, especially relevant to babies born prematurely prior to 37 weeks of pregnancy, and also any babies born with birth defects. A pediatric NAC practitioner who is a registered nurse with recognized qualifications for looking after young children and babies. Breastfeeding assistance is another important topic. It can take some effort to adjust to breastfeeding for both yourself and your baby. This is not an unusual area to have to request help for. Expertise can be sourced from a lactation consultant who can be contacted via hospital. Further information is also available via the Lactation Consultants Association. A breastfeeding peer advisor, someone who is very experienced in breastfeeding their own babies and lends their expertise to new mothers. Her experience includes guidelines on how to begin the breastfeeding process, but she is not a qualified medical professional. Check out your available local health services in order to get in touch with such help. And a breastfeeding support group. Speaking with new mothers who are going through similar experiences can really benefit individuals due to the sharing of knowledge. Local healthcare professionals and facilities should be available to direct you to some options. A case manager or care coordinator is a trained individual, perhaps a nurse but possibly also a social worker, who liaises with the various professionals that make up your postpartum care team so that all aspects of your service remain neglected and you and your baby get to make the most of the resources at hand. A home visitor, again, possibly a nurse, social worker, or another related professional who is committed to keeping up to date with your situation thanks to regular visits and contributions were recognized. A home visitor can help mothers to develop particular care skills for their baby as well as spotting any developmental signposts like teething, the ability to sit up, walk and talk, and the development of other communicative skills and problem solving. Their assistance can also put you in touch with other crucial resources like other home visit services and community health initiatives. Family and friends can also be a vital source of help and guidance at this time, providing you choose the right ones and avoid those who are unhelpful. Inform useful family members if you need assistance with meal preparation, domestic chores, or transport to appointments. Loved ones can also help you to spot any health problems, so take any observations they make seriously, including in relation to mental and emotional health. Okay, thank you for watching. See you soon.